Hello and good evening. My name is Antoine Craigwell, and I'm the president and CEO of DBGM, which is an organization that is committed to raising awareness about mental health issues impacting Black gay men to prevent their suicide. And part of the work that DBGM does is what is called the In My Mind Conference, which is a conference, an LGBT people of color mental health conference. This year we celebrate our 6th anniversary, and it will be a virtual conference, a virtual one-day conference on October 8th. Along with the work that DBGM does is that we are launching 2 support groups. One called Sons, and it's for gay men of color who are struggling with mental health and trying to work on HIV prevention. And another called Her, which means helping every woman restore. It's a group for mothers and mother-like figures of color whose sons have died from HIV/AIDS or suicide. And so we're trying to help mothers or mother-like figures of color to heal from the pain of losing their sons. But one of the things that we've done in response to the COVID-19 crisis is on May 14th, we launched a series of discussion fora. Every week, we decided to pull together people from across the country and across the New York City area to join us as presenters on specific topics impacting LGBT people of color communities and their mental health during COVID-19. This evening, we've come to our final in the series. This is our 12th presentation. And we're happy to have with us one of our previous presenters, Dr. Rischa Gottlieb, who presented at our very first discussion forum. And she did one with us when we talked about race and trauma and mental health on June 7th. And she is back again to talk about exploring COVID-19 trauma and what does life look like beyond that with shame and stigma. Is it going to be similar to the shame and stigma that followed many in our communities who were HIV positive or diagnosed with HIV? Will we have the same kind of shame and stigma surrounding COVID as we had with HIV? And also joining us for the first time and recommended by my dear friend, Dr. Wilhelmina Perry, who was one of our presenters on the discussion forum on the elderly, is Bernita Lopez or Bernie Lopez. And they are a respiratory therapist, and they will share with us a personal experience as well as a professional experience of dealing and working with COVID-19. Bernie will share with us what it was like working with patients, but also what it was like contracting the virus herself and how it's been for her recovering. How does she feel, and what does she see life look like for her? So, but before we move ahead, I would like us to take a moment in silence and think about those in our communities who have died. We think about those members of our communities who were killed by the police, or died from COVID-19, or died from suicide. Thank you. Before we actually begin, I'd like us to observe a few community agreements. One is, please keep your microphones muted. We ask you not to take photos of the screen because there are some people here who may not want it to be known that they're in a forum as this. We ask you to be respectful, even if you disagree with someone. We will use the chat box at the top right hand of the screen for questions. Please leave your questions in the chat box and indicate if we're a specific speaker or if a general question for everyone, and I will read it out. You're invited to share in the chat box your thoughts about this discussion forum. And for those of you who have been regular attendees, share with us if you'd like in the chat box, what did participating in the series mean to you? And at the end of this discussion, we will share the slides and recordings. Additional comments and questions, please, you can send an email to info@dbgm.org. Our first presenter is Bernita or Bernie Lopez. For more than 28 years, Bernita Lopez served as a respiratory therapist. 14 of those years with Burke Rehabilitation Hospital, where she taught asthma education. Over the past 14 years, she worked in the neonatal care, the intensive care, and any other units in the hospital where she was needed. Bernita was serving as a frontline worker during the COVID-19 pandemic and shares her experience of all she saw happening. Community members, I'd like us to welcome Bernita Bernie Lopez, who will talk to us about her personal and professional experience as a respiratory therapist. Bernie.
Thank you very much. Thank you for the great introduction. I am so pleased and honored to be here tonight. Um, More than you can imagine, I'm grateful to be alive. In the beginning of March, I was on a phone call. I am also a union delegate for my job, and we were on a phone call, and they started talking about COVID. And up until that time, I thought that COVID was going to be just another Ebola event where, that it was just a political ploy and that it was going to come quickly and disappear quickly just in time for the political stuff that's going on. And while I was on that call, I got a phone call. And when I got off and returned the call, a friend of mine told me that she and her husband had tested for COVID 19. And that's when COVID took on a face for me, and I began to believe that it was real. I had been on vacation. I was getting ready to go back to work the next day. And I'm telling you the truth that I became very afraid of this disease that we had no idea what it is, how it affects people, or anything. And when I returned to work, it was pretty busy as usual. And I was in a patient's room who just required respiratory treatment. And she had signs on the door for people that might have any kind of diseases, contact, and also um, it could be airborne. And so the signs were up there. When I went to give her the treatment, she was not there and the signs were down. When I turned around working on other patients, I saw her come back. And when she went into the room, I went to give her the treatment, and she was crying and saying they wouldn't let her leave. I came out, and the signs came back up, which is not unusual in the hospital. But what was different was that all of a sudden someone said, "Yeah, she's ruled out COVID," and I got a little nervous. I went to get a mask, and all of a sudden the mask had disappeared. The protective gear just disappeared. And when I asked, "Well, where's the gear? Where's the mask? Where's the things we need?" I was told, "You now have to ask the secretary, the unit secretary, or the nurse manager, and you get one a day." These things were given to us. They were accessible. You would just get one, and it was per patient. And now we're being told per day. That was pretty scary. A lot of things happened quickly, changed quickly. I'm also known to be loving, caring, and kind person when it comes to patient care. My mother died in 1988 from Lou Gehrig's disease, and I was not a respiratory therapist. So I think that that made me gentler, kinder when it comes to patient care. And so I started watching. I'm also studying for my master's in pastoral care and counseling. And so I'm often called for with palliative care to help at the end of stage life for families and for patients. And what I started seeing around me was that my coworkers were beginning to break down. Coworkers that I usually could talk to about God, coworkers that I would usually sing with, all of a sudden they were breaking down and they were just crying, they were frustrated, they were angry, and I felt kind of helpless. I kept trying to give encouraging words. I would cry before I went to work. I would try not to cry during work. I tried to be strong for those around me, and I would cry when I came home. What I began to see was something I had never seen before. The ICU took on a look of a war zone, definitely a war zone. We would double gown, double gloves, mask, shield. People were holding on to them tightly. They were like, "This is for just for our unit." If we couldn't find them, and respiratory works on all units. If there is a code, we all respond. So we work in the entire hospital. And now we were being told that we couldn't get certain things. My last day at work, before I went on the floor, I did have the ICU. Um, I held a prayer vigil with my coworkers, and I just broke down and I cried. And I'm going to try to get through this without crying. Um, but what I saw was horrific. All the ICU people were breaking down. We were now saying, if you're going in the room, can you do this, that, and the other? If a nurse was going in the room, we'd ask her to do all the things that everybody else usually does. If a doctor was going in the room, can you do this? We weren't doing care as normal. If I went in the room, they might ask me to do some nurse duties, or whatever we had to do. They had HEPA filters, which cleaned the air. They were so big, I had never seen anything that size as a HEPA filter. Um, Going into the room, and they asked us to turn the patients because the patients were on ventilators. They weren't normal ventilator patients. Normally, patients are sedated, but they still may move. They might try to reach and grab things, and you might have to put on mitts, you might have to restrain them. That wasn't happening now. The patients were not moving, and we were being asked to assist with patients as they needed to be cleaned. And so the respiratory therapist, that's me, would be at the head of the bed holding the tube in the patient's mouth as the doctors and the nurses and the PCAs or patient care aides would turn the patients over. I would look at the patients, and the patients that I dealt with, their bodies were unremarkable, meaning I didn't see any sort of trauma. It wasn't anything that you could see. And we turn them over, and they just had white, I can't even describe it, like white stuff, like all on their eyes. You know, it was horrific. I had a coworker who had the emergency room, and he came up and he was distraught because he had taken care of a patient, and the patient's chest x-ray had been clear the day before. When we came back the next day, the chest x-ray was no longer clear. I want to keep it in layman's terms. And it happened quickly, and that person was on a ventilator. They were bringing ventilators from everywhere. Ventilators were coming from the basement. Ventilators we hadn't used in forever. Ventilators were coming in just in droves. They were just every time we turned around, our managers were bringing ventilators in from all sorts of places. And it was they were trying to figure out if they could ventilate 4 people at a time on one ventilator. And we were like, well, how does that work? How do you know? How do you monitor the patient? You've got one screen, but you've got 4 people breathing on it. And, it was just people trying to figure out who got put on a ventilator and who didn't get put on a ventilator. People were dying at a rate that was just phenomenal. The morgue was full, and I'm talking about March 26th. That's not what the government was telling you, but we knew. And so March 26th was the last day I worked. I woke up on March 27th and I had a fever of 101. And I tried to convince myself that I didn't have this fever, that I just didn't want to go to work and I was afraid. But no, I had fever. I called into my manager and the assistant director to tell them that I indeed was ill. And I had to wait for 8 o'clock to try to find somewhere to get tested. And they were waiting with me. These 2 women were phenomenal. And I called and they said to call OHS where employees would go. I got to run around. No, you can come in. This was in Tarrytown. I live in Mount Vernon and work in the Bronx. Or you can come in and you can go to the ED and you can get tested. And my manager and my assistant director were just horrified at the fact that I, as a frontline worker, was having a problem finding a place to get tested. I began to wonder where I needed a pulse oximeter. Where was I going to get this pulse oximeter, which monitors your oxygen and your heart rate? I have a blood pressure cuff, so I was covered there, and a thermometer I had in the house. I actually started building a table, which I called my clinic table. And then I remembered from my home care days that I indeed did have a pulse oximeter that was here in the house. And I want to backtrack a little bit. When I said I was on vacation, when I went back to work, I was already isolating. I live alone, but I didn't want to be near my family because I was afraid that if I did catch it, that they would contract it. So I was already isolating, and now it was time to go into full quarantine. 2 friends finally told me to go to an urgent care, and I did. In the urgent care, doctor looked at me and he could see how I looked. I was so weak, and it happened so rapidly. I was so weak. I had to tell my family, you cannot come with me. I have to do this alone. You can't come. And I got there and it swabbed me, and my oxygen level was already falling, but my x-ray was clear. But for me, being a healthcare worker, I already knew that that didn't mean anything, that anything could change rapidly. And I tell you, they swabbed me. I came home and I had to ask my 28-year-old granddaughter to come get my vehicle. And I pushed my clothes outside the door and I put the Clorox wipes that I had and my the gloves. She's a home health care worker. And I told her to wrap herself up entirely and to to roll down the windows in my vehicle and wipe the entire vehicle down with the Clorox before she got in. And that was the beginning of me being quarantined and and my daughter and my granddaughter coming and dropping off things at the door. Excuse me. Dropping off things at the door and then letting me know it was there, whether it was cooked food or groceries. Um, but I couldn't eat. My granddaughter later told me when I did eat, I was putting stuff back in the refrigerator. She said, "Grandma, you must have done it because you knew you were too weak to take the garbage out." And so I just became progressively weakened. Um, the last 2 nights before I called the ambulance, I woke up struggling to breathe, feeling like I was suffocating out of my sleep, rolling around on the bed. The last night I actually was hanging off the bed, afraid to get back in the bed, and all I could call on was the name of Jesus. It was something I had never felt. I have asthma, I've had other things, and I had never felt anything like this in my life. I was afraid, and but I knew that I was never alone. And so I called my family that day and I told them, I have to call the ambulance. I have to go to the hospital. My assistant director wanted to come and pick me up. I said, no way, no way will you come near me. And so I called the ambulance. They came. They were afraid, and I understood that. And they made me walk to the ambulance and had me sit on the gurney. They didn't touch me. They didn't do any assessments. And they just took me to the hospital. So I ended up in Mount Vernon Hospital. And I'm laying there, and they did the chest X-ray and everything. And the next thing I know, they put a non-rebreather, which delivers 100% oxygen, on my face. And I was like, oh my God, I am no longer the respiratory therapist. I am now the COVID patient. And so I spent 2 days. I did not even know where I was. I became more and more weak. I had a commode next to my bed, and it took everything, every inch of life for me to get to that commode and to get back. Um, I just kept praying. I need to say that. And I had said a prayer weeks before that. And I say, God, if I am to catch COVID, I ask you not to allow me to be intubated and in the hospital alone, because I don't want to do that to my family. Because I saw many people had to drop off their family members. A lot of them never got to see their family members again. And I didn't want to do that to my family. So for 2 days, I was in the ICU. They moved me. I was on still on for the next 6 days. I was down on the regular floor. For 4 of those days, I was still on the 100% oxygen. And then they tried me on 4 liters because they wanted to get me out of the hospital because they didn't want me to get sicker. But I was so weak. I was so weak. I came home, and I had delivered oxygen. I had educated people on the lungs, and now I was the patient. They couldn't find the big oxygen tanks that they have, the concentrators. So I had this cute little oxygen, portable oxygen. And I'm telling you how God set up my life, because um, I just I had to go ahead and I had a walker. That's the way I was able to get around in the house with the walker, and be still quarantined. My life has transitioned. I am not working right now. I am actually trying to come retire. I am 63 years old. I would be 64 next month. I'm trying to do early retirement, workman's compensation. It's a lot of paperwork. There are times when I'm depressed about the whole thing. I came home, I was angry that the government allowed this to happen to us. And I've lost friends, and it's just been devastating. But I also have a great community of people between family and friends. And Dr. Perry, I thank you because she never stopped checking on me. They were my strength, and they're still my strength. Thank you.
Thank you very much, Bernie, for sharing your experience and your story with us. While you were talking, I got the sense that yours may be one of the first few stories we are hearing coming out. And I think what we may need to hear more people telling their stories. Um, because what we all know is that through telling our stories, we get to feel what you feel. We get to share in your experience. And so thank you very much for sharing that. But more importantly, I think thank you very much for having the courage and the strength to share your story. There's a whole lot more I can say about this. Are you okay?
I'm here. I'm okay. I am okay. Just reliving it.
Do you have someone that you can speak with? Maybe after this, Rischa, Dr. Gottlieb might be able to talk with you a little bit.
Oh, absolutely. Absolutely. I am getting help from everywhere. So any more help, I take it. Thank you.
Thank you. And I know that this is going to be very difficult. This was very difficult for you. Um, okay. Thank you again. So community members, I'd like us now to welcome Dr. Rischa Gottlieb. She's a founder and clinical director for New Perspective Psychological Services. Dr. Gottlieb is a licensed clinical psychologist and the clinical director of New Perspective Psychological Services. She received her doctoral degree from St. John's University, where her research fellowship focused on substance use and gender presentation in lesbian, bisexual, and queer women. She serves as the Director of Behavioral Health at Choices Women's Medical Center, where she helped to establish a department focused on providing behavioral health care as part of a holistic approach to women's health within a reproductive care center. Community members, I'd like us to welcome Dr. Gottlieb, who will talk to us about trauma, ongoing and beyond. Dr. Gottlieb.
Hi, thank you. Can you confirm that you can see my slides?
I can't see them.
Thank you. So I'm Dr. Rischa Gottlieb. I'm a clinical psychologist, and I'm talking to you today about coping with chronic trauma and especially racial trauma that's occurring in the context of COVID-19. We're going to talk about what chronic trauma is, what it does to the body, and how racism relates to chronic trauma. In the end, we'll also speak about what to do with that, how to cope with the trauma now. I'd like to invite you to begin at the end with me. If you aren't already, please sit back in your seat with your shoulders back, your chin up, and your back straight for a gratitude practice. Open your hands, palms up, and rest them gently at your sides. If you're able, ground your feet into the floor. I'd like you to say to yourself, I am grateful that when I was weak, somebody else was strong. I am grateful that when I was tired, somebody else was rested. I am grateful that when I had no words, no breath, somebody else was my voice. I am grateful that when I could, it was enough. I am grateful that when I could, it was enough. Take 3 last breaths, inhaling your gratitude and exhaling calm. You might think of a specific person you feel gratitude for, or your community as a whole. And know that right now, they're with you. So chronic trauma is a bit different than acute trauma. Acute is that kind of single one-time trauma. Let's say you get into a car accident, you're the victim of a crime or a natural disaster, a really short-term abusive relationship. Whereas chronic trauma is trauma that is repetitive, unremitting threat to life, health, and well-being that occurs over an extended period of time. And here's the key, is that it's just the threat. The threat means that you yourself may have had something happen to you, but that doesn't necessarily need to occur. You can just be living with the knowledge that something terrible is likely to happen. Now, in acute trauma, there's a sort of beginning, middle, and end. And even if there is ongoing emotional impact, your logic brain knows that it's over. Whereas in chronic trauma, you have this feeling like there is no end in sight, and the only thing one can do is to endure. And that word endure is so important. Enduring is something that we do when we're not looking for a way out. We're living with it. And I want you to hear these 2 words next to each other, enduring versus living. When we are enduring, we are not living. And what is it that we are trying to endure? Well, many times chronic trauma comes out of long-term abusive relationships. That might be a parent-child relationship. It could be a romantic relationship. It can even be an unhealthy work system, or several instances of acute traumas, one-time things happening one right after the other. Think about the illness of all the people who you have known. Think about all the friends that you have supported through their own pain at this time. And chronic trauma shows up in the body a bit differently than acute trauma does. You might have fewer specific memories, whereas in acute trauma, you might have a flashbulb. And rather than the specific place that you go back to, instead, your body, your cells hold that memory. And we're going to talk a little bit more about that. So when we're thinking about COVID-19, as well as the current series of public lynchings of Black and brown men, Black and brown women, we must talk about vicarious trauma and linked fate. So vicarious trauma, that just means that something's not directly happening to you, but you're hearing about it. And linked fate. Linked fate is the idea, it's a specific kind of vicarious trauma where you think about your own personal fate as linked to the health and well-being of the community as a whole. And social scientists find that this is particularly true for Black folks. And it makes a lot of sense. When we look around, we want to see, we judge in our environment how we're going to be able to act. Linked fate is logical. Human beings learn both by experience and by observation. Witnessing traumatic events might also cue your own memories of other traumas in your life. Now think about what that means as we have spent the last 4 months supporting, hearing about, being present for, and sometimes experiencing community members who have gotten sick or who have died family members who have gotten sick or who have died, our own possibility of getting sick. And when we watch that, even if we ourselves have never been sick, we might have a sense that our own lifespan might be short. When we watch our community suffer economically in the face of COVID-19, our own jobs feel less stable. When we see the countless videos of Black bodies being attacked, our own bodies feel less safe. And I'm going to say something radical here. Racism is an abusive relationship that people of color, and especially Black people, are in from birth with racist people, racist systems, and a racist culture. Now, on the left over here, we have a piece of education that many teachers, school counselors, therapists use to talk to people about what an abusive relationship is.
Excuse
but
me,
they're
Dr.
talking
Gottlieb.
about,
Excuse
yes.
me, we can't see your slides.
You can't see the slides.
No.
All right, hold on a minute. Let me try again.
Yes, thank you.
Thanks for letting me know.
I was trying to wait for a time when I can get a cut in. But please go ahead. Now I can see
Can
them.
you see them now?
Yes, thank you.
All right, what about now?
Yeah, yes.
All right, so these are my beautiful slides from earlier that you guys missed. Quick recap. Linked fate, vicarious trauma, and here we are. So, as I was saying,
we're just seeing a blank screen right now that says click to exit full screen.
Huh.
All right, hang on, it's loading. Okay, now we got back to you again.
I will just leave it out of present mode and we will live with it as is.
Yeah. Yep.
We can see it now.
Yep, we can see it now. This is good. Thank you.
Thanks so much for letting me know. So on the left here, we have a piece of education that many professionals use to talk to people about abusive relationships. And usually when they're talking about abusive relationships, what they're doing is that they're talking about dating relationships. They might even be talking about parental relationships. And on the right, you have experiences of racial discrimination. Now, I'm not going to read this whole thing to you, but I am just going to look at a few things. On the left, using intimidation. So that might mean using looks or gestures to make somebody feel threatened. That might mean showing a gun. Now, what does that make me think of? That makes me think of Amy Cooper in Central Park, who threatened to file a false police report against Christian Cooper, a Black man who was bird watching and asked her to put her dog on a leash. It reminds me of those lawyers in St. Louis who drew their actual guns, their weapons, and pointed them at racial justice protesters as they walked by. Now I'm thinking about isolation, using isolation on the left, controlling where people are allowed to go, controlling what you do, who you socialize with. Now, on the right, using isolation, questioning whether or not you're allowed to be in a space, questioning whether or not this is your college dorm room, whether or not you live in this building or this is your car, tells you you are not welcome here. And a lot of time, because many people don't feel comfortable seeking help either from the police or from hospitals in the time of COVID-19. Think about what that means in terms of trauma. The knowledge that if you were to get sick, you may not trust your doctor to heal you, to hear about your pain. Now, trauma lives in the body. That's something that I said a little while ago. It actually changes our cells, it changes our DNA. And those are things that we pass on to our children. There are genes that have to do with dealing with stress that put us at risk for depression. It's called FKBP5. And when we experience chronic, unremitting trauma, that gene becomes changed. And it does for our children thereafter. Now, if that gene is changed, think about what it means as now our bodies are moving through the world going forward. This fight and flight response is meant to get us out of a situation in the short term. Our bodies are not meant to be flooded with cortisol all the time. Our bodies are not meant to be constantly looking for an assailant. And it makes us sick. It makes us physically ill. So what does trauma look like in the body? It makes you tired. It makes you have headaches and stomach aches. It makes you more likely to get sick. Now think about what that means in terms of going to the grocery store in the time of COVID. It changes the way you act. You might not feel safe leaving your house, not only because of illness, but because of random acts of racial violence that you can't predict. It might be hard for you to be in close relationships because when you are protecting yourself, you may not be fully honest with the people around you. You can't trust them. And if you can't trust people, you can't ask for help. You can't go to your school advisor and ask for advice. You can't talk to your friend when you feel depressed. You feel alone. What does it do to us emotionally? Well, trauma itself causes us to think of ourselves as less than. That is a natural reaction to an unnatural situation. It causes emotional trauma, exhaustion. It causes a sense that you're watching your body move through life, but you can't connect to it, depersonalization. So many people come to my office and they say, all right, thanks for all the information, Dr. G. Can I get over it? How do I make it stop? I'd like to make it stop now. And I love that. But the truth is that my answer is complicated because you can't just get over it. And telling yourself to just get over it is detrimental to your health. So no, it won't be like you weren't sick because you were. It won't be like you didn't spend the last 4 months alone because you did. No, it's not that your personal history is going to stop influencing your life because big pieces of our life influence us going forward. But this isn't necessarily a bad thing. Resistance is proof that we exist. It is proof of our story. So when we are out there in the streets, when we are coming to a forum, when we are voting, that is proof of our experience. And yes, trauma will continue to be painful. But experiences with racism, COVID-19, and other traumatic events are not now and will never be the most important thing about you. It is a chapter in your story. It is not the whole book. Trauma doesn't have to drive how you live forever. And while it will be painful, pain is something that we are all guaranteed in this life. You don't need to suffer. Suffering is when we sip pain the way we sip on tea. Suffering is when we refuse to see that the world that we wish for isn't quite there, but the world that we have can be made worthwhile. So how do we do that? The first thing to do is to take control of your own narrative. Start by validating yourself, labeling your experiences as traumatic if they are for you. Label your experiences as racist if they are. As heterosexist if they are. Affirm that what happened to you, not because of you. There is not a thing you could have done differently to make it not happen. Affirm that your emotions make sense. Reserve your right to grief, trauma, and stress. You are allowed to be tired, you are allowed to be unfocused, and you're allowed to feel. Now, this next one is one of my favorites. Rebel joyously. And this is something that you can do when you're feeling hopeless or when trauma is getting you to be self-destructive. And I love rebellion. That probably tells you something about who I am more than anything else. And when I say joyous, that means that stands in direct opposition to self-destructive. It's something that nourishes your life, and it's playful, and it's fun, and it's helpful. And I have a couple of ideas of ways that you can rebel, but think about what rebellion means to you in your situation. That might mean wearing a political shirt to work. It might mean spending the next 4 months reading only Black and brown authors or shopping in Black businesses when you can. And speaking of playful, I'd like to give a shout out to the NAP ministry. Rest. Google that when you have a chance. The NAP ministry tells you that rest is an act of resistance in a world where you are told that you must work constantly. When Black bodies are told that they are not permitted a break, take it, and take it rebelliously. And the last thing, and most important thing you can do, is build a life worth living. Your life worth living must include your own personal identities, your racial identities, your gender identities, your sexual identities, and take time to envision what that means to you, what these identities mean to you right now. Envision how they nudge you in various spaces, like when you go to the store or show up for work, or the way you're around your friends and family. Now, chronic trauma, especially racial trauma, causes a loss of the ability to dream. You cannot build a life worth living without dreams. So make time to fantasize. If you are not currently in your fantasy apartment, then you should probably start thinking about it, especially when we're spending so much time at home. Even if that fantasy stays a fantasy, think about what you would do if you were approaching your life with playfulness and curiosity. Picture 10 years, 5 years, 1 year, and what would be perfect. Whether it's a trip to Bali or just a trip to the grocery store without a mask. You are allowed to dream. Take time to ask yourself what you want, not what you should do or what you need to do or what somebody told you to do, but what you want to do. Take time to ask yourself what brings you happiness. Your happiness is not a luxury. Now, one thing that grounds me is I am always grounded in my elders. So I am going to end this with Audre Lorde. Caring for myself is not self-indulgent. It is an act of self-preservation. It is an act of political warfare. I'm inviting all of you to engage in warfare with me. Thank you.
Thank you very much, Dr. Gottlieb. This is actually truly impressive, and I think this is truly significant as a way to bring this entire series to an end. And I particularly like the fact that you're talking about how we can live and work with our trauma and how we can make ourselves better despite of or in spite of the trauma that is in our lives. And I like the phrase, joyous rebellion. That reminds me of the late John Lewis's, Good Trouble. you know.
I borrowed from him as well.
Yeah, yeah. I think the idea of good trouble or joyous rebellion, because if you really stop to think about it, looking back in human history at all the times of rebellion and riot and unrest, they weren't acts of, they weren't, they weren't really negative acts. They were acts because people wanted better for themselves. And you could classify that as a form of joyous rebellion, because if they did not object and protest, they would not have a better life. So it was a means to an end, and it's just another twist on that. But yes, thank you very much for sharing that. I mean, I'm sure I can you and I can wax eloquently and back and forth on this. So once again, thank you very much, Dr. Gottlieb. We have a number of people who shared who were part of our series, and we want to just simply acknowledge and recognize all of these who've been present in our series for the last 12 weeks. We'd like to first of all acknowledge Ronnie Gregory James, who is a community organizer with the Mayor's Office of Immigrant Affairs. We want to recognize Giselle Fonseca, who was a fellow with the Office of Immigrant Affairs, and Alex Medina, also with the Office of Immigrant Affairs. We want to recognize Matthew McMorrow, who is now Director of LGBT Affairs in the Executive Office of New York State Governor. He was at the time when he presented within the Mayor's Office of Community Affairs. We want to recognize Dr. Zoya McCants. She presented with us here, and then she also presented on our discussion forum on domestic violence. We want to recognize Daryl Nicholson Sansani, who is a clinical response clinician at New York City Department of Education. Ayana Roberts, who's also with the Department of Education. Dr. Algernon Cargill, who's an attending physician and Division of Pediatric Emergency Medicine at NYU Langone and Bellevue Hospital Center. Julius Melvin Owens, who is a board member with our organization. Natalia Gibbs, with the LGBT and Harm Reduction Coordinator, Harm Reduction Coalition. Rosalind Rose October, Faculty, School of Human Services, State University of New York, Brooklyn campus. Adjua Osei, who presented. Kitama Cahill Jackson, who is with New Perspective Psychological Services. Cynthia Cabral, Dr. Cynthia Cabral, who is a clinical psychologist and clinical director promoting resilience, intersectionality, diversity, and equity research consortium affiliated with Hunter College. Octavia Lewis, transgender health coordinator at Montefiore Health Systems. Joanne Morn, director of New York State Office of Health AIDS Institute. Louis Square, health equity coordinator, New York State Department of Health AIDS Institute. Dr. Karen Glover, Director of Adult and Behavioral Health, Montefiore Medical Group. Javon Martin, Founder and Executive Director of Princess Jenea Place. Kate Barnhart, Founder and Executive Director of New Alternatives. Jasmine Perez, Program Director, March's House Project Renewal. Shawana Vaughn, Founder and Director, Silent Cry. Grace De Trevara, LGBT Liaison and Reentry Peer Educator, Osborne Association. Jared Trujillo, President, Association of Legal Aid Attorneys. Corlin Griffith Hunt, Dr. Corlin Griffith Hunt, Founder and Chairwoman, Create for Greatness Leadership Group, Incorporated. Eddie Sakowitz, New York City Department of Health and Mental Hygiene. Gloria Bent, Director, Weight Management, Healthy Living Programs, NYC Health and Hospitals, North Central Bronx. Javon Siri, Lead Psychotherapist and Clinical Manager, NYC Affirmative Psychotherapy. Simone Davy Jingur, Co-Director for Jahaji Sisters. Joy Agnes Events. Christine Perumal, Esquire, Safe Horizon. Carolina Hoyas, Director Caregiver Supports, NYC Department for the Aging. Dr. Wilhelmina Perry. Andre Guest, Deputy Director, Griot Circle. Kyan O'Connor, Dr. Kyan O'Connor, College of Behavioral and Community Services, Department of Mental Health Law and Policy, University of South Florida. And we want to share with you guys that we've got two groups coming up, Sons and Her. And as we shared at the beginning, Sons is a group for gay or SGL men of color who are struggling with mental health issues, as well as examining their HIV diagnosis and risk factors impact on their self-acceptance. And Her, which is helping every woman restore for women and mothers and women, mother-like figures of color whose sons died from HIV, AIDS, or suicide, who haven't grieved or mourned, and who blame themselves. Both of these forums will begin weekly as online virtual forum. So thank you. Thank you very much. So is anybody got any questions, any comments? I see there are a whole lot of stuff in the chat box. Okay, so this is Bernie saying that she's honored to share. Thank you for your appreciation. It tells me all that I endure and it's worth it. Okay, any questions, any thoughts, any comments? Bernie, when you were experiencing the COVID-19 trauma and what was going on with you with COVID-19, what were you thinking? What was going on in your mind? How were you feeling? And how do you feel now?
Well, I was strangely at peace with whatever God had for me, because I knew that there was nothing that I could do to change it. My prayers had already been said. It's pretty much today. I have my moments like you saw, when I remember, when I relive it. And then there are times where I'm so grateful, all the time. I'm so grateful to be alive. I'm grateful to be able to spend time with family, friends, and there are times when Dr. Gottlieb hit it on the head. I am tired, and I don't understand what it is. I have some times that I don't sleep. I've gone 36 hours without sleeping one time. Just like my life is in transition, and I don't know where it's going, because my path has been changed. But one thing that I know, that God never makes a mistake, so wherever He's leading me, I'm following.
Thank you very much, Bernie. Dr. Gottlieb, it is clear also from Bernie's sharing the trauma that is associated not just with COVID-19, but as you talked about in your presentation about racism and race and how this all compoundedly affects us. Mm-hmm. But we are entering into a phase, in a sense, even though the virus is rising around the country and we're still in the first phase, in the first wave, and there's likely to be a second wave. But for us here in New York, for example, who've experienced the peak of this, and now we are in a trough and we are kind of feeling a bit of a complacency. How do we talk about, or how do we interact with each other without perpetuating shame and stigma and discriminating against someone because they may have COVID, even though they may not be wearing a mask? I mean, how do we navigate that? How do we, I mean, when Bernie, for example, sees somebody without a mask and knowing that that person is perpetuating and can cause someone else to become infected and can even cause her to become reinfected and she can get pissed off, how do we deal with that? How do we manage that? Hang on, before you answer, we are at 7 o'clock. So if people want to leave, please do, but we're going to continue for a few more minutes. I am hopeful that Bernie and Dr. Gottlieb might want to stay for a few more minutes. So answer me that question, please. How do we deal with the shame and the stigma that comes is it something like how we will embarrass people for being HIV?
You know, I wouldn't want to speak to the experience of a person living with HIV, but when I think about the anger and resentment that some very, very rightly sometimes feel when they see others that don't take mask wearing seriously, what I tell myself is that most people, most of the time, are doing what they believe is right. And if I'm secure in what I believe is right, I must extend that kind of grace to somebody else and a general little measure of doubt that they're not trying to attack me personally. They're simply moving through the world in the best way they know how, keeping their families safe in the best way they know how. And does this mean that in every moment I feel charitable? No. But I try to remind myself of that when I'm feeling uncharitable for a while.
Good. Thank you. So thank you very much again, Dr. Gottlieb and Bernie. Thank you very much for sharing your story. One of the things that I think I can take comfort from your story, Bernie, is that it opens up this conversation and begins to make it a little easier for others to share their story. Because a lot of people may be feeling trapped with their own story and not sure, one, how to share their story, but two, whether people believe them, or three, how they will be treated when they share their story. How they will be judged or discriminated against or looked at when they share their story. And one of the more important things I think that you were able we were able to see and witness your vulnerability in sharing your story. And that, in a sense, that says to all of us, not just with COVID-19, but with whatever story we have, that we can feel comfortable to know that we can share our story and not be ashamed, not be afraid, and that we may not be alone with our own story. You know what I'm saying?
Mm. Yes.
I mean, taking the thousands in New York City, for example, who, like yourself, have had the virus and recovered and are able to share their stories, to know that I wasn't the only one. I survived and I am stronger for it. And I can tell you what it was like. Okay? Do you want to hear? Do you want to know? And my story might help you keep your mask on. You know? So, any final thoughts? Any comments? Anything else you guys want to share? Bernie, Dr. Gottlieb?
I like what you said because there was some shame, as if I had done something, because my management company sent letters out that they were going to let people know who had COVID and who didn't have COVID. And I was like, well, I sent a great email telling them, first of all, there's HIPAA, and how do you know, and who are you to share it? And the government's sharing it, but yes, thank you, Dr. Gottlieb. But I realized that some shame came with it, and as I emerged back into the community, I realized that I had one sister that was afraid of me. I had a friend who would say, "Let's meet somewhere," but we had to drive separate cars and get there, and I don't think it was more than 6 feet, So there's a lot that comes with it. Even now, people will say, well, you're negative, right? And in fact, my lungs are still inflamed. So they won't test me again. People say, get tested. And I'm like, I would love to. I just have to find the right place once again. And that brings up such feelings for me. Why do I have to fight to be tested? I'm fighting to live. That's what it feels like for me. But you hit head on when you talked about masks. Oh, Dr. Gottlieb, you know what I'm saying? Because for me, I had to learn to exhale and relax, because it was an offense to me when I would see people and in the gloves. I'm like, Jesus, I'm like, so I've learned to say my story now is, if you go to the doctor and the doctor takes care of that patient and comes into your rooms with the same gloves, do you want the doctor to touch you? Because they think that it's my thing about cross contamination with gloves. And mask, I kind of just learned to move away. My family, of course, after seeing what I went through and experiencing that, all wear masks, including my great grandchildren. And it's horrific because you have nowhere for children to go, play, and interact. So it's greater than just adults, elders who can't get out, you know, afraid to go out. You know, it is worldwide, and even though they're opening the doors, you know, I'm so grateful my church won't open the doors. We have virtual ways to meet, you know, so it is a life-changing event that's happening right here. Never seen anything like this in my lifetime.
Thank you very much again. Thank you very much again, Bernie. Dr. Gottlieb, one of our attendees has said, with all respects to the doctor, I think we cannot accept the individual rationale. This is a public health issue for all. Your thoughts on that?
I absolutely respect that opinion, and there's part of me that agrees with that. But then there's the other part of me that has to walk around the city and pass by people who are unmasked and know that those people believe something different than I, and I will extend them the grace to be able to do so, rather than fomenting in my own heart a sense of anger and resentment that sometimes I do feel. And so while I want everybody to be masked, and I believe very, very strongly in social distancing and in masking, I have to believe that even if somebody disagrees with me, they're extended the same unearned latitude that I'm extended, just by virtue of being a person. And it's not necessarily about a personal belief of the efficacy. It's about how I want to move through my world. And at the same time, I and everybody else has the right to be very annoyed when it comes up.
Thank you. Thank you very much, Dr. Gottlieb. Bernie, thank you again, and thank you to all the members of the community who attended, who participated in this our final discussion series, in the final forum in our discussion series. And I think it's a fitting way to end. Maybe the question that I have here is for Bernie and Dr. Gottlieb. What does the future look like? What does it look like for us? From your experience as a personal experience as well as professional experience, Bernie, and Dr. Gottlieb as a mental health professional, what does the future look like? Where do we see ourselves now? Bernie?
Well, for me, it's pretty scary. Our millennials have crossed the color line. The color line has been blurred, and I love that. They're also a different species than I've ever seen, but they are their thinking is very strange and different, but they're bold. They're not afraid to die. And so in doing so, they have risen up against social injustice and inequalities and oppressions, and they are putting themselves at risk. And that is my fear, that they are out there and they are without mask and no social distancing. And so COVID can definitely be spread not just amongst them, but amongst their loved ones and their friends and their families. And so, yes, another wave is coming. Yes, it will be worse than the first. And people don't believe that. So where does our future stand? We have to live. We have to live with what is given to us. We have to live a day at a time and not be fearful of what might be or what might not be.
Thank you. Dr. Gottlieb?
You know, I think Bernie captured so much of the spirit of what I hoped to say as well, that the future is uncertain and sometimes it's really scary. And at the same time, we have no choice but to live.
Okay. Thank you all very much. How do you feel? How do you guys feel?
I feel wonderful.
Dr. Gottlieb?
Likewise.
Are you sure? Huh?
Of course I am.
I'm just checking. All right. Thank you guys very much. Thank you. And
Thank you.
For being part of this. And
thank you for inviting me.
We'll be in touch.
Overjoyed.
Yes, thank you guys very much again. Let me end the recording.